Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and we're here with our co-host, Dr. Ruvain Rubenstein.
How are you?
And our special guest today, Shaul Gavoni out of Commerce Township.
Thanks for coming.
So I wanted to start off talking about your background. I know you were born and raised in Israel, and some of your training is a little bit different than some of the training here in the United States, and some of your methods are different than a traditional physical therapy office, and I want to start off talking with you about your background and your training.
Yeah, I was born and raised in Israel. I went through the army. I was an officer in the army, a medic, and I actually was going to go to medical school. Then I got attracted to physical therapy. I changed and decided to become a physical therapist. I hold a bachelor's degree from Ben Gurion University in Israel, which coincidentally is more extensive than what they teach here in the United States in the typical program. I came here for a couple of months in the 90s, and I stayed. I worked in different settings. I worked in hospitals, in home care, and in 2002 I opened my own practice. I see a variety of patients. I work a lot differently than most physical therapists. Unfortunately, I was involved in a fatal car accident in 1994, and I needed care of physical therapists. And at that point of time, I became frustrated with the care that I got because I actually got worse. And I started to seek some alternative methods, which were very helpful. And then I started to take classes in these methods. I do myofascial release, I do craniosacral therapy, I do muscle energy. And on top of this, I developed my own techniques over the years, and I copyrighted them. So now I look at the body holistically, and I treated it as such. I find that a lot of therapies that work only on the prescribed problem don't really help very much, or just partially help.
And I personally really like your approach. One reason why we are able to refer you as many patients as we do, we love that you work holistically instead of just on point of pain or point of injury. You want to look at the whole body, the whole structure, the whole framework, and that's very similar to our philosophy as chiropractors. We want to look at the whole spine, the whole structure, because structure dictates function. If the structure is wrong, whether it's the spine or the nervous system or other joints, it dictates function of the body.
I totally agree, and I found, and I really appreciate your cooperation with the patients, because I find that working on the patient simultaneously, I find that the effect is much more effective, the whole process is much faster to get the patient on the path to recovery, and it's really a win-win situation. So I appreciate that very much.
So what would you say is different between you and the traditional physical therapist?
Most physical therapists, unfortunately, in this day and age, work like an assembly line. So you go in, they put you on exercise. A lot of times the patients don't even get a chance to see the physical therapist themselves very much. So the patient end up seeing an assistant or a technician. In my facility, it's only one-on-one with the physical therapist. And the second thing, that gives me 100% chance to give the patient my expertise, my knowledge, and my experience, and to evaluate him or her properly and treat them as such. The second thing is, a lot of times these patients in other facilities, they go on machines or they will do all kinds of stretches, whereas it's actually exactly what not needed to be done. A lot of times I find, and again, that's the similarity between our approaches, I find that misalignment of the body plays a major role, and before you go into realigning the body, everything else is becoming irrelevant or unhelpful. So that's the base for everything. Several times, I mean, I see people that went to 2, 3, or 4 physical therapists which were unsuccessful, and by going back to basics, working on realigning them and releasing all the muscles and the fascia, everything becomes much easier to manage and on the long run.
So the way you said that, an example for our audience would be something like, let's say someone has, let's say maybe a shoulder injury where they strain some of the muscles in, let's say, the rotator cuff, but they also had damage and pinched a nerve in their neck. That nerve is going to their shoulder. Well, if the nerve is pinched, it doesn't matter how much they do to the shoulder, they're not going to be able to get innervation, so that's not going to be able to heal properly. So like I said, we look at the body as a whole, and we want to correct the problems where there's a problem, not merely where there's a symptom.
Exactly, and a lot of times in cases, this is a great example, because a person like this that has a pinched nerve, even if I will do some myofascial releases, I will release the soft tissue, I can do some mobilizations of the spine, but I really cannot get that deep to the level that you can with them. You can really disengage the spine even more, so my work can be more effective. And that's great. So in a case like this, I would be more than happy to refer the patient, because this really works for the patient much better.
Absolutely. I know we can work very well together. And a common misconception that a lot of people have is that, you know, if someone's seeing a chiropractor, they can't have physical therapy. If they're seeing a physical therapist, they can't have a chiropractor. Or if they're under medical care from a orthopedic, then they can only have that. And that's not the case. You know, our goal, and most physicians' goal, every physician's goal, should be just to do what's best for the patient, to help the patient. So my personal belief is that we can have as many people help as we can, as long as it's going to help the patient. We're always happy to co-manage with physical therapy, with pain management and rehab, with orthopedic. As long as it's going to help the patient, we can all work together. And so that big misconception is out there that, you know, if you see a doctor, you can't see a chiropractor. If you see a chiropractor, you can't see a physical therapist. And that's not the case at all.
And you were talking about co-managing. I think co-managing is the best possible way to make sure, we want to make sure the patient gets results. That's the biggest part about healthcare, that I don't know if traditional medicine, they care more about the patient, but I know in our practice we care about results in the patient, getting them better. And I tell our patients all the time, you know, working out is great, you have to make sure that those muscles and ligaments and tendons, that they're connected to bone. You have to make sure that those bones are also in the proper alignment, or you can work out all day. If the bone's not in alignment, they're always going to be pulling out of place, they're always going to be tight. So absolutely co-managing is the best possible way for the best results in a patient.
I totally agree.
It's like a car that's out of alignment. If you have a car that's out of alignment, you could change the tires, and what's going to happen is they're just going to wear again.
Yeah.
And the more you drive it, the faster they're going to wear. And so if you have a body that's severely out of alignment, it doesn't matter what you do. You can work it out. And even though the exercise you could do is great for your cardiovascular system, you're going to cause more wear and tear on the joints, cause earlier degenerative changes, earlier osteoarthritis. Even because you're working out, even though working out is great for the body, we have to keep healthy alignment, or things wear out faster.
Yeah, I'm sure you've heard in the medical profession, they may say, oh, the reason that this disc looks like this is because of age. Oh, this is, oh, bad aging of your disc, it's normal. Well, this disc is the same age as the one above and the one below it. You weren't born with one disc and then the next one came and the next one. They're all the same age. They should all look the exact same.
It's with any joint. The cartilage in the knee,
exactly.
they say, well, that's
so
because
all
you're
your
older.
joints are the same age in your body.
Both knees
so
are the
there's
same.
a reason
Both
why
elbows
one
are the same.
degenerated faster than the other
Right.
one. So
It could be poor misalignment over time, or more trauma to the system, more wear and tear. But yeah, everything's the same age. All your
Exactly.
organs are the same age. All your joints are the same age. They should wear out at the same exact rate.
yeah. So
And unfortunately, I find a lot of times that patients, or sometimes unfortunately even the physicians, would not refer them, or the patient will just try to delay it and say, oh, it's going to get better on its own, let me wait another month. They're not realizing actually it makes things a little harder and longer to release. And it's really a good opportunity for all of us to emphasize that early intervention is the earliest the best. Really.
Waiting is the worst thing that people could do, because
Right.
the longer they wait, especially with a type of injury, they can have scar tissue buildup, they can have adhesion buildup, then it takes longer for us, it's harder for us to take care of such a thing, and so the earlier people take care of themselves, the better. I always like to use the analogy that symptoms are like a warning sign. Symptoms are the tip of the iceberg. You know, if you see an iceberg, a little bit of it is above the water, and the majority of it is deep underneath the surface of the water. And most of the time, symptoms are just the tip of the iceberg. The problem is underlying, and it's probably been there for a long time before they may have even felt the symptoms, unless it's a direct injury. And so the earlier we take care of it, the better. And the symptoms are like a check engine light in the car. Most people, the check engine light comes on, and they just keep on driving.
Right.
But the best thing to do is get it checked right away, before problems get worse.
Yep, it's all about preventative care. I mean, I'd rather the patient under care for a long period of time so they're not crawling into my office with an acute issue, because we've been checking them over a long period of time and making sure that they are in their proper alignment, their muscles are right, their tendons are right, their bones are all in alignment, so that they're living a full functioning life. And then, you know, maybe something happens, you said like a trauma could happen, and then, okay, that we know what's causing this problem.
Right.
But if a patient's crawling into your office in acute pain, they've had 20, 30, 40 years, their whole entire life, that could have been built up to that issue.
It's easy to sort out whether it's
Yeah.
just from that or all these different things, right? So if they are in normal, healthy function, normal, healthy alignment, then you're right. You know what trauma happened, we know what happened.
We know where it's at. So.
Right, exactly.
And that's true. I see this also in practice. A lot of people say they define the startup of the problem as when they started to feel the symptoms, and I say exactly what is it's really started long before that. It never starts. This is just your body is telling you that. Another thing that I do differently, I always, when I discharge the patient, I give them stuff to do at home, and I give all my patients the option to come for checkups, which we do for free.
That's great.
Yeah.
Do
So I know I have a peace of
regularly.
mind that they are where they need to be, and they have a
yeah.
peace of mind that they are where they would. So they really don't need my services on the long run, and they.
And
can
I love that you do
continue
the
on.
home care instructions too, because people shouldn't just only get work done when they're hurting and then forget about their
Right.
body, their joints, their spine forever. It's important to do maintenance, home care, and keep their body as healthy as possible.
Right.
Yeah, I mean, we use the analogy like braces. You know, you get braces for 2.5, 3 years to align your teeth. Once they come off, you have the retainer for life.
Right.
Because you want to protect what you've corrected.
Right.
You don't want your teeth to go back to the way they were before you had braces for 3 years. Right. So orthodontist tells you, hey, wear this retainer at night so your teeth stay nice and straight. And I mean, that's the best way to do it. So you got to make sure you
And a lot of people just don't understand that with their structure and their body, it's out of sight, out of mind. Maybe easier to see their teeth than the rest of the body inside. And a lot of people's opinion is, if it ain't broke, don't fix it. If they don't feel symptoms, they think everything is perfect. And if they do feel symptoms, they think everything is terribly wrong, which is not necessarily the case. Sometimes people could have symptoms and not have that much problem. They could also have minimal symptoms and have a bigger problem.
Yeah, and I mean, you see marathon runners in tip-top shape. You see athletes and all these top professional sports, and all of a sudden, not all of them, but some you see, they actually dropping dead. Professional athletes drop dead. People that, I mean, there was a professional baseball player just recently that passed away of cancer. I mean, he was a tip-top shape of his health. All of a sudden, his career ended, boom, body started degenerating rapidly and passed away at 54 years old. So, I mean, you see these people that you think, okay, these are the top athletes in the world. They must be in the best health, but that's not the case.
Yeah.
So
Not necessarily the case at all. So I know we also do see a lot of patients with traumas and injuries, things like that. I know we co-manage a lot of patients with whiplash and car accidents. So tell me some of your experiences with whiplash and automobile accidents.
Yeah, I see. Typically, I like to see, unless the patient has a really severe injury, they need to be hospitalized. Most of these patients that are rear-ended or I like to see them as soon as possible after the injury. I really emphasize this to physicians. A couple of days. Recently, actually, my office manager was in a rear-ending injury, and I saw she had X-rays, everything was okay. I saw her the same day. And I just needed to see her 3 visits. She was fine. I gave her some stuff to do. She was fine. She was back to normal. If she waited, the typical person would wait a week or 2 weeks or whatever.
I see people that wait 9 months.
9 months.
I see people that come in.
It
they
would
said they had
have
an
been an
accident 10
ordeal.
years ago.
Yeah.
let the
And people don't realize that.
You got to get to it before the inflammation starts.
Exactly. Before adhesions are building up.
Yeah, exactly. Get to it when it starts. The best time to take care of a problem is when it begins, not down the road and, oh, now the symptoms are here, let's take care of this problem.
We'll see people come in that say they had a car accident 10 years ago and never did anything about it. In fact, we'll have people that don't even say that to me. I'll take an x-ray and I'll say, did you have an accident 10 years ago? And they're, how'd you know, doc?
Right.
We can see the damage. We see old damage. We see degenerative changes on an old whiplash where the structure of the cervical spine is reversed. We have advanced imaging where we see it right in our office. We have a video cinematography x-ray. We see exactly where there's restricted motion. And so we can tell where there's an old injury and things like that as well. And unfortunately, people wait years and years before they take care of themselves.
And I'm ashamed to say that after I was involved in a car accident, because I walked away from a car accident, and it was in 1994, I kind of took it easy because I thought that I was okay. I didn't feel any symptoms at the beginning. The symptoms started to develop about a week, 2 weeks later. Actually, the first person I saw was a chiropractor. I lived in Texas back then, and he worked on me, and then I saw a physical therapist. But that waiting was really working against me.
Absolutely.
And I always think that if that happened to me and I'm a physical therapist, that definitely happens to everyone. And I think that's the main thing that we need to emphasize to the public.
A lot of times
really
too,
important.
after people have an injury or whiplash type accident like that, they may feel decent for the first day or two before inflammation starts to set in,
Right.
because they also have a lot of adrenaline pumping
Right.
when they were in the accident, so they don't necessarily feel it. Then even sometimes up to a week later, they may start to feel soreness in the front of their neck, on the sides of their neck, the back of their neck. Almost sometimes even feels like a sore throat because they have some damage in some of the ligaments and the muscle tissue in the front of the neck, as well as the back of the neck too.
Right.
Most people think, oh, I wasn't, my leg's not broken.
Right.
You know, I didn't fracture, I'm not bleeding everywhere, so, oh, I'm all right, I don't need to call the ambulance. But what's going on underneath your skin could be way more detrimental to your overall health and well-being than a broken bone that's going to heal in a couple months,
Right.
you know.
Or even they will have an ambulance ride. They'll go to the hospital, and a hospital and emergency room is great for life-saving procedure at the moment. They're going to check if you have a fracture, a broken neck, a broken spine. If not, most likely they'll prescribe something and send you and say, okay, everything checks out okay. That doesn't mean there's no injury. That doesn't mean there's no whiplash. And so unfortunately, a lot of people get that perception. They say, well, they went to the hospital, everything was checked out, and they were fine. Now 4 months later, it just kept getting worse and worse and worse. Now they come see me, 4, 5, 6, 7 months have gone by, and they thought they were fine. Emergency room is a fantastic place to go to make sure to get checked out. They'll do MRI, they'll do a CT scan right at the hospital, check for a concussion, brain injury, all sorts of different things. But if there's nothing broken or severe brain injury, they're just going to send you right home.
Yeah, and that's where this co-managing thing we were speaking earlier
exactly.
would come more into play. I mean, if they just realized the effects of co-managing with chiropractors and physical therapists, that these people's overall health later in life can be so much better, that's probably the best way to manage a patient after all car accidents.
Communication is key too. Communication among all the different types of physicians. Well, the chiropractor can talk to the physical therapist and the pain management and rehab doctor, and they can talk with the orthopedic surgeon. It's really nice to have a good relationship and a good rapport between all the different physicians as well, so they can report everything that they're doing and everyone can stay on the same page.
Right. And ultimately, I always tell the patients, even when I refer them to a chiropractor, ultimately the patient is the final judge. They are the ones that feel better or not, and they can tell usually.
We can't feel what they're feeling.
Yeah, they usually can tell the difference between them seeing me alone or seeing you alone or seeing this co-management is really tremendous for the patient. There's no question about this.
And so, what you're looking to do and what we're looking to do is get to the root of the problem, the structure, the alignment. But again, sometimes people may need a little more help right away, and that's why we deal with, pain management physicians and orthopedic. They may need to get, a pain shot or something like that. They have to.
If they have that broken bone, set it and put it in the cast. I'm not telling you.
No, exactly.
Ship them to the chiropractor's office, send them to the physical therapist.
And so that's why we can work well with the physicians and the specialists.
And not just
as well, absolutely.
And I think that you probably see this in your practice too a lot of times, that sometimes the patients, even after whiplash or any injury, they would be suggested because they have a pinched nerve to have surgery, and they're really not necessarily a candidate for surgery.
Yeah.
That's way beyond them. And then once they try the physical therapy, the chiropractic, and they feel better, they really, oh, I'm glad that I didn't do it.
Right.
Or sometimes I see the opposite, the person that ended up having surgery, and now they are in trouble for the rest of their life because it's irreversible.
Yeah.
And they really should have avoided this surgery, but they were
I always
misguided.
like to say that people should always try conservative first,
Right.
drug second, surgery last.
Right.
There's no reason not to go in that order.
And there's nothing to lose with going with the conservative. There is something to lose if you went too far.
Once you're cut open and you're fused together, you
Right.
can't unfuse your spine. So
Right,
you might as
exactly.
well try the least invasive and work from there.
So we have a little video clip that we'll roll just about some of the whiplash injury that we see, and we'll roll that. We'll talk about it in just a minute.
Sure.
And one thing that we find is really interesting with whiplash type injury is it doesn't have to be a 70-mile-an-hour fatal accident to cause a whiplash in somebody.
Absolutely. I mean, we're talking about a 2,000-3,000 pound car and a 150 pound person inside this car. No matter how hard it is, we're talking two huge objects hitting each other, and you're just basically a rag doll inside of it, taking the blunt force of the trauma, and you're not even thinking about it, but there's a lot of force being put into your ligaments and muscles and tendons and bones and all these things that, like we said earlier, it may not be a cut, a broken bone or something like that,
right.
but the damage to your spinal cord could be life-threatening. I mean,
and the thing is, we have a larger head and a smaller neck. So our head is sticking out. And so the neck has to support that whole head. And when you're going, even 10 miles an hour, as you stop, the whole body is stopping, but the head keeps going. And so there's ligaments, and the soft tissue damage happens here. There's posterior longitudinal ligament, anterior longitudinal ligament. They can be stretched, they can be torn. The soft tissue and the musculature can actually be ripped and torn. And what will happen then is if we leave it alone, it's going to heal. However, it's going to heal
the
wrong
way. Yeah,
and
absolutely.
so then it's a lot harder to take care of this muscle tissue and ligamentous tissue that's healed the wrong way. And so we see that a lot of times with whiplash. But you know, the problem is that our heads are so much heavier than our neck. If we didn't have our head sticking out, we wouldn't have as much damage from whiplash. But because the head is out, it's like a bowling ball sitting on a stick. For every inch the head even goes forward, even while we're sitting still, we're putting an extra 10 to 15 pounds of pressure on the musculature, on the ligaments, and on the spine, in the cervical area, and in the upper thoracic area.
Forget just talking about a whiplash injury. The majority of the population already has poor posture to begin with. So you add the poor posture, and then you have this whiplash injury. So it's a double whammy, and then we're completely having major issues going on.
Whiplash doesn't have to just be from a car accident or a slip and fall. You know, you saw in the little video clip that the kids were playing, or the professionals were playing football. We see in sports injuries so many times whiplashes that don't even realize it, whether it's from football or hockey or boxing. I see almost as much whiplash with gymnasts as I do with football players.
Yeah.
And we see that.
I mean, people don't think about it, but you have to think any
Anytime
sudden
the head's going to go
movement
forward or
like
backward
that.
very fast like that, it's going to whip the spine, whip the cervical.
And that's the most important part of the spine right there. That's where the brain sends all the signals right through the top part of your neck. So, I mean, it's a very important part of your spine to take care of.
And those first two bones are shaped differently than any of the other bones in the spine. And so most people don't realize. They think every spinal bone is exactly the same. The atlas and axis are shaped a little differently. The atlas sits almost like a donut on top of what we call the axis, which has like a little, like a thumb like this. And that's the reason you could turn your head.
Yeah.
And so an injury there is much more devastating because that's where the brainstem area goes through.
Yeah.
And I find a lot of times that the person, especially in motor vehicle accidents, they anticipate the impact, and before this anticipation, these fractions of seconds, they tense, and they tense up, and that magnifies the damage even more.
Absolutely. All the muscles are contracted so they can rip and shear at the muscles.
Yeah, I know when they teach you how to, if you're going to properly fall down, they want you to just relax and take the fall and not tense up, because once you tense up, all the muscles are tight and stuff like that. So you want to make sure that.
It's easy to say, but it's hard to do,
Yeah,
right?
right.
It's happening. It's hard to do it. And
it's
the natural instinct is to just tighten up. And
yeah, I mean, when you
get
see
ready
a
to
car in
take
the
impact.
rearview mirror about to slam into you, it's hard to be like, let me just relax right here.
Yeah. And even worse is, you know, when you tighten up, you pull your head forward too. You don't lean back. So with the head forward, you're already setting yourself up for more whiplash, because the normal structure of the cervical spine should arc backwards. So most people right away, boom, head forward, hunch forward, and so even more trauma can happen from something like that.
I know I was in a car accident when I was 15, and this person made an illegal U-turn and they slammed right into my door. So not only was I hit, but my head was turned sideways. So with your head turned that way, it's even worse, because that's definitely not a normal position to be in. So it was almost a sideways whiplash, and there was a lot of damage.
Accidents of all different types. Side impact, especially sometimes we'll see where the whole car spins. Even though it may not be going very fast, the whole car spins and hits a wall. So now you're going, your head's already moving around in circles, and then you hit one way, so it's going to kink and just totally move the neck the wrong way.
Yeah, so I mean, as chiropractors and as physical therapists, we want to make sure that these patients that are in these whiplash injuries get into our offices as soon
soon
as
as
possible.
possible.
Yeah. That's what it
Absolutely.
comes
Yeah.
down to.
Yeah.
Come into our offices as soon as possible so we can check you out, make sure, you know, maybe you didn't get damage, but there's a good chance you did. I mean,
Right, exactly.
Right.
we're not saying that every person that is going to walk into our office and their spine's going to look like a 95-year-old person,
Right.
but there's a good chance that after an accident, it's going to.
Right.
So all we're saying is get into our office, get checked out, and we want to just take care of people.
And again, we're more than happy to work with any different type of physicians, and of course, primary care included. A lot of times, some physicians may not be as familiar with a whiplash type injury too, so we want people to know that to see us, they can always come for evaluation for physical therapy, and they can even come for appointment through a chiropractor, for a chiropractor without referral. We're a point of access, so people can just come right in and see us for an evaluation. And we're always glad to communicate with, again, any of their physicians, primary care specialists, and we're happy to do that, but they don't need to wait for approval to come in. Because sometimes by the time they wait for that, it could take a lot of time. And so I know you can do evaluation
And
as well.
I offer free evaluations, totally free, because it's so important to me, even regardless if the patient end up being my patient or go to another, you know, it's so important for me this person doesn't get in troubles down the road, that I do this all the time. Yeah, absolutely.
And we're trained that if we do find something, to know who to refer them to.
Yeah, absolutely.
So,
All right.
I mean, that's the best part about it. We do know who to refer to if the need be, but we just want to make sure.
It's always good to get opinions too. Someone needs a new roof on their house, what do? 3 opinions.
They call the first
Right.
guy. Absolutely not.
Yeah, no, they get 3 opinions. Someone has a problem with their body, what do? Just do, you
Yeah.
know, a lot of times do nothing. But never hurts to see multiple people and get multiple opinions.
Yeah. I mean,
And it is interesting how people treat everything around them, whether it's the dogs, the house,
Yeah,
much
better
better.
than
They
their
pay
own
more
self. Right,
attention
right.
than their own
Exactly.
selves. That's
Definitely their
yeah.
dogs.
Yeah,
Yeah.
yeah, definitely. Yeah.
But even house, everything.
yeah.
You get lots of opinions, lots of information. You know, this is an information age, so there's so much great information out
Right.
there about healthcare, about physical therapy, about chiropractors. I always encourage people to look, find information. We have lots of videos available. People can look on WTV10, see episodes of our show. They can go onto YouTube. They can get information all over the place. A lot of peer-reviewed medical journal articles. I know, Dr. Rubenstein, you've been published in medical journals. I've been published in medical journals. I think you've written some papers as well. We encourage people to look at medical research as well as, you know, testimonials, all sorts of different things.
Yeah, exactly. I mean, educate yourself. I mean, this, like you were saying, it's the educational age. Everyone's on the internet. Most of their patients are already coming in. They have diagnosed themselves on WebMD.
Right. Don't
So,
take our word for it.
I
Right,
mean,
exactly.
they've already diagnosed
They already
themselves.
have
We're
20
just
different
here to
conditions that
confirm
they
it.
told. Exactly.
So, I
Right.
mean,
Thank you for having me. I appreciate that.
And thank you for joining us as well. This has been Ask the Chiropractor. I'm your host, Dr. Adam Rodnick. We are here with our guests, Shaul Gavoni and Dr. Ruben Rubenstein. And we'll see you next time on Ask the Chiropractor. Remember that God gave you the gift of life, and what you do with that life is your gift back to God. We'll see you next time.